Hello dear students, welcome to this program. Today I am going to talk about drugs, their nature and sources, and their routes of administration. Before discussing the topic in detail, let's first note its objectives. Number 1, how are drugs defined? Number 2, what is the nature of drugs? Number 3, what are the main sources from which drugs are obtained? And number 4, what are the routes of drug administration? Let's first discuss the definition of drugs. A drug may be defined as a natural or synthetic substance which, when taken into a living body, affects its functioning or structure and is used in the diagnosis, mitigation, treatment, or prevention of a disease. A drug may also be habit-forming stimulant or narcotic substance like alcohol, cannabis, nicotine, or a derivative of poppy, which produces a state of arousal, contentment, or euphoria. Continued or excessive use of such substances causes addiction or dependence. The former refers to legal drugs and the later as illegal drugs. The term drug refers mainly to chemical or plant-derived substances that affect psychological, behavioral, or physical functions and lead to varying degrees of dependence or addiction. Let's discuss now the nature of these drugs. Based on the nature of their chemical groups, drugs can be classed into various groups: alkaloids, glycosides, flavonoids and proanthocyanidins, tannins, terpenoids, resins, and lignans. Alkaloids. The alkaloids are heterocyclic nitrogen-containing compounds, usually with potent activity and bitter taste. They are of limited distribution in the plant kingdom. The various groups of alkaloids like tropane alkaloids, pyrrolizidine alkaloids, and methylxanthine alkaloids have diverse clinical properties which are mentioned below. Tropane alkaloids have anticholinergic activity. They are also used medically to reduce smooth muscle spasms, hypersecretion, and pain. Pyrrolizidine alkaloids inhibit pain, cancer cells, and bacteria. They also help in stimulation of bone marrow leukocytes as well as myocardial contractility. Methylxanthines bind to adenosine receptor and elicit neurological effects in man and animals, which may be regarded stimulating at low to moderate intake. In rodents, high intakes of methylxanthines show reduced sperm production and testicular atrophy. Now, coming to glycosides. These compounds consist of various categories of secondary metabolites bound to a mono or oligosaccharide or to uronic acid. The saccharide or uronic acid part is called the glycone and the non-saccharide part the aglycone. The main groups of glycosides are cardiac glycosides, cyanogenic glycosides, glycosinolates, saponins, and anthraquinone glycosides. Now, the clinical properties of these glycosides include: they inhibit sodium-potassium ATPase pumps in cell membranes. These pumps are critical for the functioning of the cardiac cells. Therefore, these compounds result in increased contractility and reduced heart rate. Cyanogenic glycosides interfere with the iodine utilization and result in hypothyroidism. Some saponins induce photosensitization and jaundice. Anthraquinone glycosides help in induction of water and electrolyte excretion as well as peristalsis in colon. Now, flavonoids and proanthocyanidins. Flavonoids consist of a central 3-ring structure and proanthocyanidins are oligomers of flavonoids. And the clinical properties include: they act as general antioxidants. Several structures reduce inflammation or carcinogenicity. Now, tannins. There are two distinct types of tannins: condensed tannins, which are large polymers of flavonoids, and hydrolyzable tannins, which are polymers composed of a monosaccharide core, most often glucose, with several catechin derivatives attached. The clinical properties include: they are used as astringents in cases of diarrhea, skin bleedings, and transutates. Now, terpenoids. The terpenoids are synthesized via the 5-carbon building block isoprene activity. And the clinical properties include: they are antineoplastic, antibacterial, and antiviral. They are also important in gastrointestinal stimulation. Now, the resins. The resins are complex lipid-soluble mixtures, usually both non-volatile and volatile compounds. The non-volatile fraction may consist of diterpenoid and triterpenoid compounds, and mono and sesquiterpenoids predominate in the volatile fraction. And the clinical properties of these resins are: most resins are antimicrobial and wound healing, but their actions depend on the composition of the chemical mixture. Resins are generally safe, but contact allergy may occur. Now at last, the lignans. Lignans are composed of 2 phenyl propanide units to form an 18-carbon skeleton with various functional groups connected. They are gently lipophilic and have structural functions within the plant cell membranes. Lignans show phytoestrogenic and antineoplastic effects. Now let us discuss sources of drugs. Drugs can be obtained from natural sources like plants, animals, microbes, etc., or can be prepared synthetically. First, we will discuss natural sources of drugs. Nature has been a source of medicinal agents for thousands of years and continues to be an abundant source of novel chemotypes and pharmacophores. With only 5 to 15% of the approximately 250,000 species of hair plants systematically investigated and the potential of marine environment barely tapped, these areas will remain a rich source of novel bioactive compounds. It's apparent that nature can provide the novel chemical scaffolds for elaboration by chemical and biochemical approaches, thus leading to agents that have been optimized on the basis of their pharmacological activities. First, we will discuss the plants as the sources of drugs. Plants have formed the basis for traditional medicine systems which have been used for thousands of years in countries such as China and India. These plant-based systems continue to play an essential role in healthcare, and it has been estimated by the World Health Organization that approximately 80% of the world's inhabitants rely mainly on traditional medicines for their primary health care. Examples of important plant compounds developed for the benefit of human health are: ephedrine, first isolated from Ephedra sinca, is the basis for the synthesis of the anti-asthma agents salbutamol and salmeterol. Now, tubocurarine. It's the muscle relaxant isolated from Cododendron and Curaria species and used by indigenous groups in the Amazon as the basis for the arrow poison curare. Vinblastine and Vincristine, isolated from Catharanthus roseus, has anticancerous properties. Papaver somniferum has given rise to 4 important medicines. The plant is very old painkiller and a sedative. The 4 important alkaloids found in opium that are used as medicines today are morphine, codeine, noscapine, and papaverine. Now, citrinquine. It's isolated from the plant Citricornus nux vomica. This compound is used as a muscle relaxant in connection with operations for killing animals, and due to its bitter taste, it enhances the gastric juice production, leading to a better appetite. Now, quinine. Malaria is one of the most fatal diseases worldwide. An old, well-known remedy for treatment of malaria is the quinine, isolated from the bark of tree Cinchona species. Now, artemisinin. Artemisia annova is an old Chinese anti-malaria remedy called Qianhou. This was shown to be an effective remedy both as prophylaxis and in the treatment of malaria. Now, podophyllatoxin. It's a resin compound isolated from the roots of Podophyllum peltatum. Podophyllatoxin was also the lead compound giving rise to the development of the medical drugs tinoposide and etoposide, today used against several types of cancers. Now we will discuss the microbes as the source of drugs. The accidental discovery of penicillin from the filamentous fungus Penicillium notatum by Fleming in 1929 and the observation of the broad therapeutic use of this agent in the 1940s ushered in a new era in medicine, the so-called Golden Age of Antibiotics. This discovery promoted the intensive investigation of nature as a source of novel bioactive agents, and microorganisms have proved to be a prolific source of structurally diverse bioactive metabolites, which have yielded some of the most important products of the pharmaceutical industry. And these include antibacterial agents such as penicillins from Penicillium species, cephalosporins from Cephalosporum cryptosporidium, tetracycline from the actinomycetales. The immunosuppressive agents like the cyclosporins and rapamycin from Streptomyces species, the cholesterol lowering agents such as mevastatin and lovastatin from Penicillium species, and Anhelmintics and antiparasitic drugs such as ivermectins from Streptomyces species. Cyclosporin A, isolated from the microfungus Tolypocladium inflatum, has immunosuppressive properties. This product revolutionized the survival period for people needing transplantation of organs and has given a large number of people an elongated life. Now, the marine sources of drugs. The world's oceans, covering more than 70% of the Earth's surface, represent an enormous resource for the discovery of potential chemotherapeutic agents. The first notable discovery of biologically active compounds from marine sources was the isolation of the C nucleosides spongouridine and spongothymidine from the Caribbean sponge Cryptotheca crypta in the 1950s. These compounds were found to possess antiviral activity. The sea hare Dolabella auricularia from the Indian Ocean is the source of more than 15 cytotoxic cyclic and linear peptides called the dolostatins. The extremely potent venoms of predatory corn snails have yielded complex mixtures of small peptides which have provided models for the synthesis of novel painkillers. The other sources of drugs include teprotide, isolated from the venom of the pit viper Bothrops jarasca, is used in the treatment of cardiovascular diseases. Now, Epibatidine, present in the skin of a frog Epipedobates tricolor, has been shown to be 200 times more stronger painkiller than morphine. This was discovered because natives used the extract of the skin as an arrow poison. Now we will discuss synthetic sources of drugs. Synthetic drugs are synthetic compounds of naturally occurring chemicals, for example, synthetic marijuana and bath salts. The short-term toxicity of these drugs has been shown to be problematic for individuals and could have lifelong impacts also. However, as these drugs have only recently infiltrated society, not much is known about the long-term effects and further research is needed. Based on their chemical makeup, synthetic drugs are commonly divided into two categories. First, we will discuss cannabinoids. Popularly known as K2 or spice, cannabinoids are chemically formulated versions of synthetic marijuana that consist of lab-manufactured tetrahydrocannabinol. Users report greater anxiety, discomfort, nausea, confusion, paranoia, desire for the feeling to end. These synthetic chemicals negatively affect short-term memory, emotional stability, motivation, learning, reasoning ability, and stamina. Now, cathinones. Often known as bath salts, cathinones contain chemical compounds that mimic the effects of cocaine. This is a powerful drug that causes severe side effects. Bath salts are sold as crystalline powder with names such as Every Wave, Blow, Red Dove, Vanilla Sky, Aura, ZS2, Zoom, Bliss, Blue Silk, White Lightning, Ocean, Charge, White Dove, and others. The symptoms of bath salt use are severe paranoia, seizures, violent behavior, decreased need for sleep, hallucinations, lack of appetite, chest pain, and self-mutilation. Users frequently describe the high as horrible and report seeing demons, monsters, foreign soldiers, or aliens. Some have symptoms for 2 to 3 days. Some require long-term psychiatric care because their symptoms do not improve. Long-term health problems that result from the use of bath salts are kidney failure, long-term mental illness, increased risk of suicide, self-mutilation, liver failure, and death. Now we will discuss the routes of drug administration. A drug will produce its action only when it enters the body, tissue, or cells, that is, site of action. So the entrance through which a drug is delivered is called the route of drug administration. There are various ways of administering a drug or a chemical to a site in a patient or animal from where the chemical is absorbed into the blood, and these include systemic route and local route. First, we will discuss the systemic route of drug administration. In systemic route, the drug reaches to the systemic circulation, that's the blood. This systemic route is further classified as enteral route and parenteral route. In enteral route, the drug is placed in the gastrointestinal tract and it absorbs to the blood. The drug can be administered into gastrointestinal tract through oral route, sublingual route, or rectal route. In oral route, the drug is placed in the mouth and swallowed, and absorption takes place along the whole length of the gastrointestinal tract. But drug administration through oral route is sometimes inefficient because only part of the drug may be absorbed and destruction of drug occurs by gastric acid and digestive juices. The most important concept associated with oral route of drug administration is the first pass effect. The first pass effect is the term used for the hepatic metabolism of a pharmacological agent when it is absorbed from the gut and delivered to the liver via the portal circulation. The greater the first pass effect, the less the agent will reach the systemic circulation when the agent is administered orally. Now the sublingual or buccal route. In this route of drug administration, the drug is placed under the tongue and absorption occurs in the mouth. So, rapid absorption occurs and the drug is quite stable because the drug does not go to the stomach. so it is not destroyed by the enzymes and acids present in the stomach. Now rectal route. In this form, a drug is mixed with a waxy substance that dissolves or liquefies after it is inserted into the rectum. Because the rectum's wall is thin and its rich blood supply, the drug is readily absorbed. It is prescribed for people who cannot take a drug orally because they have nausea, cannot swallow, or have restrictions on eating, as is required after many surgical operations. Now, parenteral route of drug administration. In this route of administration, the drug does not pass through the gastrointestinal tract. It directly reaches to the blood. The drug can be administered with the help of injections, which can be intravascular, intramuscular, or subcutaneous, or without injections, which include inhalations. Injections can be given to unconscious patients and it has quick action, but there is greater risk of adverse effects because high concentration is attained rapidly and pain occurs at the site of injection. Drug administration without injections is pain-free and rapid onset of action occurs due to rapid access to circulation. Now, the local or topical route of drug administration. In this route, the drug is applied on the skin and mucous membrane for the local action. It's all about this topic. Hope you understood well. Thank you.